I'm curious. I am curious. Curious
by nature.
Welcome to Curious by Nature. I'm Jessica Johnson from Newswise. Despite growing awareness of the potential harms of excessive alcohol consumption, college students in America remain prone to binge drinking. What can administrators do to encourage kids to stay within safer limits? It's a fine line between education, intervention, and outright prohibition. While some campuses promote dry events and alcohol-free dorms, reputations of so-called party schools remain an attractive aspect of college life for some students. Research at the George Washington University hopes to unpack the motivations behind problem drinking and identify ways to prevent the worst risks of students' alcohol use. Today's guest has seen firsthand in her role as a family nurse practitioner and dean of the GW School of Nursing the consequences of drinking-related injuries and harms of binge drinking. She's here to talk about her research and explore the causes and potential solutions to the worst aspects of drinking culture on college campuses. Dr. Kelly Weider, welcome. Please introduce yourself.
My name is Susan Kelly Weider. I'm a professor and dean at the School of Nursing at George Washington University School of Nursing.
Can you tell me about what you do and kind of what your work is like?
My work is in college high-risk health behaviors, predominantly college-age drinking and disordered eating behaviors. And I became interested in looking at college drinking problems first. I'm a family nurse practitioner, and I worked in the college health center. And one particular day I saw every student I saw who came in for care had some alcohol-related problem. And I just thought it's a bigger problem than I thought. So I decided to start looking into it a little bit more.
I'm really curious when you say that people were coming into with alcohol-related problems. What kind of problems were those?
So it was kind of funny. It was the Monday after spring break. I used to work Monday afternoons and Friday mornings in the health center. And this Monday afternoon, I expected it to be kind of quiet. The students had all just come back from, their vacation. And I had a full packed schedule, and I thought, oh my gosh, okay. Every single kid I saw had something. Someone broke their leg and then had to come while they were in England, and then they had to come and be seen before they had to have another x-ray. So I said, well, how did you break your leg in England? Oh, well, I fell down a flight of stairs. Well, how did you fall down a flight of stairs? Well, I was drinking. And then the next student I saw had a broken arm or a broken wrist, and someone else had been in a car accident. And then I saw a young man who told me that he was sure he needed to be HIV tested. And I said, okay, well, why do you think you need to be HIV tested? And he said, well, I just came back from spring break and I was very drunk, and I know I had sex a lot and I don't really remember what I was doing. And I thought to myself, this is a little ridiculous. These students are really, drinking too much. Which it was striking that so many of them had different complaints, but all related to how much they had been drinking.
Tell me maybe about specific research you're doing now.
We looked at the co-occurrence of binge eating and binge drinking in college students. So one of the things I discovered through clinical practice was not only were these college students drinking a tremendous amount, many of them were really not eating in a logical way. It was actually an undergraduate student said to me, when I told her that I was looking at, going to study college alcohol use, and she said, well, the big problem is the girls stop eating on Wednesday. I said, what? She said, the girls stop eating on Wednesday because they want to save up their calories for the weekend so they can drink. They don't eat all weekend. And I thought, oh, that is just so bad, because not only are they metabolically, that's pretty horrible, but they're going to be suffering the effects of the alcohol more strongly because they haven't had anything to eat. So I actually started looking at the co-occurrence of these behaviors. And it's a very interesting history. If you look at the literature across generations and across population groups, women who go into treatment for alcohol disorders often have a history of an eating disorder, and the other way around. Women who go into treatment for eating disorders often have a history of alcohol abuse. And so I said, there's something here that we've never really thought about. And colleges are, considered hotbeds for eating disorders. And no one really had ever looked at the combination of the two and how they might impact each other. So that was actually my kind of niche that I was most interested in. And it was, we found some interesting things. We developed a motivational intervention based on work that people had done about alcohol, reducing alcohol use. And we looked at binge eating specifically, and really kind of correlating the two interventions really was effective in getting people to at least identify that perhaps the way they were eating was ineffective and not healthy, much as we had seen with alcohol.
Was that almost, do you find that that is almost the point, that a lot of people maybe stop eating or don't eat a lot so that they can feel the effects of alcohol more quickly?
College-age men and women are very different in how they do this. One of the studies I did was I actually looked at the sequencing of the behaviors, because I actually thought, so if the girls are not eating and then they drink a lot, then they must eat a lot, right? Which is, you do see that. But men do something very different. Men just eat more and drink more, right? It's when they're drinking a lot, they tend to eat a lot. And so it's a very different kind of response, where the girls don't eat at all because of the caloric concerns.
Oh, so it's not because maybe they want to feel the effects of the alcohol more quickly.
They're more worried about the weight gain.
Do you find on college campuses, I mean, especially GW, it's a very international community. Do you find that there are differences in approach to alcohol with different cultural backgrounds?
Absolutely. And the literature will tell you that the environment of the school has a lot to do with how much drinking there is. Schools that have really active athletics, particularly schools with big football teams, schools with Greek life, schools with sororities and fraternities, obviously Greek life, places that are kind of known as drinking schools do have much higher rates. We know now that the numbers keep climbing in terms of the number of college-age students who are drinkers. It used to be in the 40s. A couple of years ago, it was 49% of college students. Now it's 51%. So it's going up continuously. And there doesn't seem to be any end in sight to how high this will go. Although, again, I do think some schools are more prone than others.
Why do you think that there is this increase?
There's certainly a link to the stress of a college experience. I often wonder now, as we see an increase in mental health problems in college-age students that we didn't necessarily recognize as much before. We've seen this real increase in the last few years. If that's a way of treating the underlying depression or anxiety that the students might be dealing with. We know that alcohol and drug use can certainly be used to treat symptoms of mental health problems, right? And that students may not recognize that they're having any mental health problems, but they are self-medicating themselves with alcohol.
What do you think will be maybe your next research study looking at this topic? Do you have an idea?
I'd really like to look at what we did previously was 2 separate interventions, one for binge drinkers and one for binge eaters. What I'd like to do now is look for more of a tailored approach where I can incorporate the two. So it became a very cumbersome problem for the student who was in the study, because they had to go through one whole assessment and then another whole assessment. There's so many things that are similar that I think we could integrate those two and then test a motivational intervention that attempts to target both behaviors at the same time, because there's so many similarities.
What do you find fascinating about this area of study?
Alcohol is available to everybody, right? And there are so many people. I'm an old ER nurse, right? I've seen patients through the years with long-term complications from long-standing alcohol use, right? And a lot of these behaviors we see in young adults and college students, lots of kids outgrow this behavior, right? 10 years later, they're not drinking like this, but many of them continue to drink like this all their lives. And the long-term health complications, both of the drinking and actually the disordered eating, can be really very complicating.
How do you think that these habits can change? I mean, do you have specific actions that maybe you have seen or recommended to students to be able to manage their drinking better without abstaining completely?
Right. So that's, it's the whole social piece of this, right? Because everybody in college drinks, right? That's sort of the theory. So there's a lot of things that have been, from a prevention standpoint, right? How do you manage to drink for some period of time without getting so intoxicated that you end up with alcohol poisoning or some additional, of those complications? But things like having a partner, having someone with you who agrees that they're not going to drink as much, like let's not drink too much tonight, or let's have a drink and then a glass of water, then another drink, right? So alternating a non-alcoholic drink with an alcoholic drink. Different, ordering different kinds of things. We often find that there are lower alcohol. Some things have lower alcohol rates, and so those might be a safer thing to drink. It's just sort of pre-planning, making sure you eat before you go out drinking, or before you start drinking. And just, I think with college students particularly, they tend to be in groups, right? And so this is not individual behavior. I mean, it's individual. They're each drinking, but they're drinking in groups of people. And sometimes it's beneficial to have someone like kind of be watching out for each other, right? So this kind of team approach to the night, or those all work if people are willing to use them. And we know that alternating a non-alcoholic drink with an alcoholic drink is probably one of the best things they can do.
You mentioned this a little bit, that usually they continue drinking at the same rate into their adult years, let's say. Does that, though, is it also, if they are heavy drinkers in college, it kind of predisposes them to alcoholism more so?
No, it's interesting. I was looking at the statistic a little while ago, and it just ran out of my head. But a certain percentage of college students actually meet the definition for an alcohol use disorder. So there's a very standardized definition of what that is. And we don't usually think about, those of us who do college drinking don't think of the students that way, because we think of them as college students and they're binge drinkers, or they're not, or they're excessively high binge drinkers. But we assume they're all going to outgrow it. But if you look at how much they actually drink, a huge percentage of them, I'd have to double check the number, but a really significant percentage of them actually meet the criteria for an alcohol use disorder.
What would you say to parents and students that are in their senior years now in high school and they're planning on going to college, where they're deciding to go, how to handle themselves, things like that?
I think people need to know that this is more prevalent than they may assume. And I think parents of high school students, particularly their firstborn, I can use myself as a perfect example. I didn't think my children were drinking when they were in high school, right? Yeah. And I was kind of on the lookout for it, right? And so I was very worried about them going to college. And yet, as it turned out, kids do a good job of hiding that from you. And so so the parent needs to kind of really be paying attention to what the high school environment is like, what they see their kids doing, what they see their friends doing, and really try to get an honest interpretation of where the child is now prior to going to college. Mm-hmm. Then I think you really have to talk about the school that you're going to. Some places are known for that. And if you're going to a school where the drinking rates tend to be higher, I think parents need to have serious conversations with their children about what that means and what the expectations are, and how are they going to prevent injury and calamity, right? And so some of these preventative mechanisms, I'm one of those people who believes that they are probably going to do it, so it's better that they're prepared and that you try to prevent a problem than to assume my kids just won't do this. That's a bad assumption.
Are there any questions that you would like to answer that I haven't asked you, or anything you'd like to mention?
I think the main point is this is continuing. It's continuing to not get better, right? If anything, it's getting worse. The rates of drinking in college is continuing to climb. And there are some serious complications and consequences of this behavior. Most kids this stage, like, they still talk about the risk for drunk driving and motor vehicle accidents. I would say in the Northeast, where I've spent most of my life, we see that the kids are much less likely to drive. Uber has been a huge godsend in some respects, because we have seen in certain parts of the country, we've seen a reduction in drunk driving and motor vehicle, which is good, right? I mean, I think the kids know better than to get in the car and try to drive, which past generations has not been the case.
Right. What do you think about news reports touting the supposed benefits of moderate alcohol consumption? For example, the idea that antioxidants in red wine are good for you. Is there really any level of alcohol consumption that is good for us?
Now, that gets really controversial. I just read something the other day. I love to tell that story. Oh, red wine's good for us. But, we're starting to look at that data a little bit more closely, and that perhaps that where they're not so sure anymore that even those low to moderate levels of alcohol consumption are great for everyone. There may be subgroups that is more beneficial for, and then other subgroups that is really not beneficial at all. It's the jury's out on that. I think we're still continuing to see stuff that's contradictory. But I think that's what we're going to find. In certain subgroups, some of these things, like a little red wine, might be fine. But in other subgroups, that would not be as important, not be significant.
You said that there's a way to analyze or whether someone has a disorder. Is there a certain amount of alcohol consumption for a college student that's the line, there's a problem?
This is a great question, actually, and it's really relevant to college students. We specifically look at college students in terms of whether or not they're binge drinkers or high-intensity binge drinkers, right? So binge drinking in college students, and kind of across the world, but I mean specifically in college students, is 5 drinks in 2 hours if you're a man, 4 drinks in 2 hours if you're a woman. And the definition is a blood alcohol of 0.8 or higher. Once you get to an alcohol level of 0.8 in a short period of time, then it's considered binge drinking. So when we think about college students, we talk about whether or not they're binge drinkers, right? And so it's either you're a binge drinker, because many of them drink at that rate, or they're very kind of occasional drinkers. They'll have a glass of wine or two, right? And or a beer or two. That's a smaller portion of your college students. Most of them are drinking at this rate of 4 or 5 drinks in a 2-hour period, and many of them drink in far excess of that. So up to 10 drinks in a 2-hour period.
If you could finish the sentence of, I'm curious about.
I'm really curious about what we can do as healthcare providers and college administrators and faculty and staff to help prevent the consequences that we see in our students. I'm very happy to be here because I think the rates are much lower, and I feel like this is much less of a problem than in my previous life. College is such a unique period of time for most students that they're in this very, interesting area. They're away from their parents maybe for the first time. They have all this independence. They have a lot of time on their hands. School is very different than being in high school. And we have an opportunity to help them get to the next stage of their lives. And I think by ignoring some of these behaviors that we know exist, we're not helping them, right? We need to really, I think, as institutions, do more to help them understand the complications of what they're doing and how, there are other options, right? There are other options.
Yes, that would be wonderful. I mean, if the rates could start lowering and there could be solutions to this problem, that would be great, because I imagine that we will see the effects of this later down the road as well.
For generations, I think, really. It's interesting in that, we used to always think of this as a very separate time in life, right? So we didn't really worry about how it tied to later on down the road. But over time, people started looking at it and saying, well, these kids that drank a lot here are these people who drink a lot here who, end up with early liver disease and, significant complications.
That is so interesting. It has been considered like this time of do whatever you want and get it done with.
Yeah, like, you'll outgrow this. Yeah, go right, be silly, right? But it's, for some people, it is okay, but for some people, it's not. And actually, for most of them, it is not. Because even if nothing terrible happens, their grades, there's all kinds of things. Kids who drink a lot don't do as well in school. They have more social problems. They have more interactions with faculty and the police, and, goes on and on.
Thank you so much.
Curious by Nature is a production of Newswise. More than 7,000 journalists get the Newswise wires. Visit newswise.com and find out how to spread your news today.